All right, let's be real for a second. You're a dentist, and you're amazing at what you do. You literally build smiles. But somewhere along the line, you were also told you have to be a marketing genius on the side. It's a huge ask, and it can feel pretty overwhelming.
Does that sound about right? You're juggling patient care, running a team, and then there's this constant pressure to get new patients in the door. It's a classic case of wearing way too many hats, and it's a struggle for so many dentists out there.
And look, if you feel like you're just kind of throwing things at the wall and hoping something sticks, you are definitely not alone. But here's the good news. You don't need to go get an MBA. Your most powerful marketing weapon is something you already have. It's your expertise.
So let's totally reframe how we think about marketing. We're going to flip the script, moving away from those old school pushy ads and into a space that feels a whole lot more natural, just being genuinely helpful. And that, my friends, is the heart of content marketing.
Here's the big idea. Content marketing isn't about selling at all. It's about teaching, guiding, and solving problems. It's a strategy where you use your incredible knowledge to create stuff that's actually valuable, attracting the exact patients you want long before they even think about booking an appointment.
This slide just nails the difference, doesn't it? A traditional ad basically shouts at people, but content marketing, it answers a real question for a real person who's actively looking for help. I mean, which one do you think really builds trust? It's a no-brainer.
And that's exactly why this works. It's all built on a foundation of trust. When you're the one providing helpful answers online, you're not just another clinic on Google Maps. You become a credible go-to authority. And that trust, that's what turns a random website visitor into a loyal patient who raves about you to their friends.
Okay, so theory is great, but how do we actually do this? Let's break it down into a super simple, actionable game plan. There are really just 4 core steps to get this whole engine started.
It's pretty straightforward, really. First, we figure out exactly who we're talking to. Then, we sketch out a simple plan. After that comes the fun part, actually creating some helpful content. And finally, we just need to make sure people can find it when they're searching online.
And I can't stress this enough. Step 1 is everything. Before you write a single word, you have to know your audience. Are you talking to young families who need a kid-friendly practice, or professionals looking for cosmetic work? What are their biggest fears? Is it anxiety about the procedure or worry about the cost? Knowing this changes everything.
See, once you know who you're talking to, building the strategy gets so much easier. What's the main goal here? Do you want to rank higher on Google or just get more online bookings? From there, you pick your format, blogs, videos, whatever, and set a schedule you can actually stick with. And remember, showing up consistently is way more important than posting every single day.
All right, now for the fun part. And I promise, it's easier than you think. Your best content ideas are sitting in your office right now. They're the questions your patients ask you every single day. A simple blog post on whether teeth whitening is safe. Perfect. It's a real question from a real person.
Or what about a quick video? You could shoot a simple 2-minute clip on your phone showing the right way to floss. It's practical, it's super shareable, and it immediately positions you as the helpful expert. That's pure value right there.
And for those bigger, more complex topics, visuals are your best friend. An infographic that breaks down the dental implant process can take something that feels scary and complicated and make it clear and manageable for a nervous patient.
So, you've created this awesome content. Now, how do you make sure people actually see it? That's where a little SEO, or search engine optimization, comes in. Just think local. Find terms people are actually typing, like emergency dentist in, your city. Weave those words in naturally. Write a title that makes someone want to click, and you're golden.
But listen, hitting publish is not the finish line. You can't just post and ghost. The real magic, the thing that builds lasting relationships, happens when you engage with your audience and keep an eye on what's actually working.
This is where you go from just having followers to building a real community. Responding to a comment on social media shows you're a real person who actually cares. Sending out a monthly newsletter with useful tips keeps you top of mind. These little interactions are what turn patients into true advocates for your practice.
So, how do you know if all this effort is paying off? Well, you can track it with 3 key metrics, or KPIs. First up, the most basic one, your website traffic. Is your content bringing more people to your digital front door? That's the first sign that you're getting discovered. Next, you look at engagement. Are people just visiting or are they sticking around? Are they liking, sharing, and most importantly, are they commenting? Engagement is the digital version of a head nod. It tells you that your message is actually connecting with people.
And finally, the one that really hits the bottom line, more patience. Is all this traffic and conversation actually translating into new appointments being booked? This is the ultimate proof that your content strategy isn't just a nice to have, it's actively growing your practice.
Okay, deep breath. We've gone through the whole game plan, but the biggest takeaway is that this doesn't have to be complicated, and it definitely doesn't have to feel salesy. The most important thing now is to just start, to move from plan to practice.
So that brings us to the final, most important question. What is one small thing you can do this week to get started? Seriously, just one. Maybe you'll write that first blog post, or maybe you'll just brainstorm 3 patient questions you can answer next month. Don't overthink it, just pick one thing and do it.
And I really want you to remember this. Your greatest marketing asset isn't some fancy software or a big ad budget. It's you. It's your expertise. It's authentic, it's valuable, and nobody else has it. Now's the time to start sharing it.